Hi, I'm Joe Fifer, President and CEO of HFMA. Welcome back to our web video series. This month I'm talking about hospital mergers. Merger and acquisition activity among hospitals and health systems is heating up. Last year there were 115 merger announcements. That's a substantial increase over the year before. The momentum shows no signs of slowing because the market forces that are driving consolidation are accelerating. Surprisingly, no, at least not in the first couple of years after the merger. HFMA worked with the Deloitte Center for Health Solutions to analyze the results of 750 hospital acquisitions or mergers over a multi-year period. We discovered that acquired hospitals had lower operating margins, revenue, and expenses for the first 2 years after the transaction. In other words, early success is not likely. In many cases, that's because the acquiring organizations had to make significant investments in the hospitals they were acquiring. We also discovered, through in-depth interviews with finance leaders involved in the mergers, that there is a critical success factor that doesn't show up in the spreadsheets or the management reports. That factor is cultural alignment. A hospital is a very complex organization by nature and by design, as anyone who works in one can tell you. Hospital mergers make regular corporate mergers look easy. One of the big lessons learned by the hospital and health system executives we interviewed was, don't underestimate the importance of differences in organizational cultures. I can attest to that from personal experience. Back in the 1990s, I was part of a merger in Lansing, Michigan. Our consultant told us that the two hospitals' cultures were very closely aligned. Well, that couldn't have been farther from the truth. In reality, we had different leadership styles, different decision-making processes, and different approaches to managing employees. To make matters worse, we didn't tackle these issues directly as we should have done. Looking back, it didn't have to be that hard. Here's some advice you don't hear every day. Look up from your computer screens and talk to people, preferably face-to-face. Email is not going to cut it. The executives interviewed in our research emphasized that the discussion time is essential, especially in the early stages. Not just small talk and getting to know you conversations, although those are part of the process. You need to have the crucial conversations about sensitive topics, and you should do so early on. If the merger isn't going to work, better to find out sooner rather than later, when the transaction will be costly and difficult to unwind. And if the merger does go forward, leaders in both organizations should get the need to be purposeful about blending cultures and aligning leadership. Because if you don't spend that time to do that up front, you'll spend a heck of a lot more time on it later. Thanks for watching. I'll see you next month.